Uh, Hello everyone. So today we are going to have a quick session on diaper dermatitis, which is also called the napkin dermatitis. This is a very common finding which we usually see in children, especially the infants or the newborns, as the mothers try to actually use these diapers as a way of containing the urine and then the fecal matter from these children. So as you can see in the illustration that I've shown, you find that the child will have this erythematous rash in the diaper covered areas, as you can see here. And oftentimes it involves the gluteal area, the inner thighs, and oftentimes it can spare actually the folds. So if you open up the legs clearly, you find that in the skin folds, the skin is actually normal. So diaper dermatitis has a prevalence of at least 50% of all infants that use these diapers, and it is a very major cause of concern, especially in among the mothers who are taking care of these children. It is a big concern because you find that the diaper is the option they have as a hygiene equipment, but at the same time, it is causing problems. So they end up actually consulting about it. They're worried, they're anxious, and it is due to allay their fears. So the predisposing factors include pre-existing seborrheic dermatitis. We know the infantile type of seborrheic dermatitis. We have already done a video on seborrheic dermatitis, so you can go and watch it. So this is one of the predisposing factors. And other factors like the dampness, the exposure to urine, the fecal matter, which can end up acting as either irritants or allergens that can actually trigger a reaction. The ammonia from the urine was once blamed for this issue of diaper dermatitis, but now the low alkaline pH of urine and then the fecal bacteria are the most significant factors that are implicated in diaper dermatitis. So when you look at the fecal bacterial enzymes like the proteases and repases from stool, they can also act as irritants, particularly in an alkaline environment. Then the ureases from the fecal matter can also act to raise the pH, the urine pH, and at the end of it all, you have a raised pH, which is now ground for the action of the proteases and lipases from the stool that now irritate the local area. Then we have also feeding factors where there's thinking like cow milk formulas promote bacterial growth, and this increases the likelihoodness of a child developing the diaper or the napkin dermatitis as compared to those children that are just purely on breast milk. So you find that breastfeeding is actually protective against this diaper rash. And then skin breakdown is also one of the factors that has been implicated. And in this case, when you put on the diapers for longer periods of time, they are wet, they're already full, then they can be damp and then end up actually even mechanically irritating the skin and breaking down the skin barrier, making the skin more sensitive to allergens and irritants. So alkaline pH is now also encourages the proliferation of the Candida species, so the child can now end up with Candida infection as a complication of the diaper or napkin dermatitis. Then physical irritation from the friction of the diapers, if they're ill-fitting, the irritation from the chemicals they use to make these diapers, all this can give rise to the irritations that can give you the manifestation. So oftentimes it is localized to the diaper area that includes the buttocks, the genitalia, and the upper thighs. So characteristically, you get erythema, erosion, so even scaling. Sometimes one even get weeping lesions. The common form, usually it is due to irritant contact dermatitis, which typically spares the genitocrural folds. So all those skin folds, when you open them, the skin there is usually very, very normal. And then later on, you can also get Candida species complicating the area. And in some children, they can have underlying other skin conditions like either psoriasis or even seborrheic dermatitis that can also affect the intergluteal areas. And this worsen the napkin dermatitis. So as you can see in this picture, we see this erythema around the perianal area. Now, this was due to an irritation from the stool, from contents of stool, and you've seen that in the stool we have different enzymes like the lipases and the proteases that act very well in an alkaline media. So your urine will be acted upon by the urease enzyme to increase its pH. So when the urine is now contaminating this area, and then the stool is also coming in the picture. So when these mix, they give rise to a strong irritant that can actually give you the right this rash. As you can see here, this one had fecal incontinence, and then also this one, and then also this one reacting from the diaper. So occasionally you can maybe see such a picture where you see erythematous papules and edematous papules as well along the diaper areas or the diaper covered areas. That includes the bum, the gluteal area, the upper thighs, as well as the genital area. So as you are getting diapers, they are now diapers that are made specifically for children with this very, very sensitive skin, whereby in these diapers, they try to minimize as much as possible, removing all the possible irritants that have been identified earlier. So in the differential diagnosis, you can look at things that can look like diaper dermatitis. This can include contact dermatitis, fungal infection, especially Candida, or even severe dermatosis like seborrheic dermatitis, the infantile type, or even the psoriasis that can tend to be, can give you an inverse picture, what you call the inverse psoriasis. So in terms of treatment, in an acute phase where there is a rash, itching, and what, you can do your mid-potent corticosteroid preparation, and in this case, we prefer that you use either ointments, which have less irritants and less preservatives and have better penetration. And then you can also do topical imidazole creams if you are suspecting a co-infection with Candida. If you get spectaclitosis, maceration, and the rest, wetness, and then you can think about Candida. And then in that case, you can give any imidazole cream like miconazole or even itraconazole, or even ketoconazole cream, and that will be it. Then in long-term management, you have to avoid the causative factors like prolonged diaper. So the child at least the diaper should be changed more often. And then you also avoid the irritant substances which can be in skincare products or in even the clothing the child is putting on. Then we can also do emollients like paraffin or Vaseline moisturizer, or you can also do zinc paste preparation. In this case, it will try to dry out the area. It is very, very good. It is protective against the development of this rash, and it also has a soothing effect. But then you have to be very careful because some children have a reaction to zinc oxide. So for this particular one, you cannot use the zinc paste. So you can opt for other modalities. Thank you very much. God bless you. And I think this is one of the last sessions in eczematous dermatosis. And you can go and watch all the, I think, 11 videos that we've uploaded as regards to eczematous dermatosis. See you in the next section.